Any patient who has epilepsy coming to see the specialist, it'll help both them and their specialist if everything is in place. So the doctor needs to have his notes and know the case, and the patient, similarly, it will help them if they're well prepared for the appointment. And having a careful thought about how many seizures they've had over a period of time, perhaps a seizure diary. This can be very good. It's very easy for all of us to forget when certain things have happened, and if you're going through a low phase, to maybe exaggerate in your own mind how many seizures have occurred, and the opposite is true also. So preparing a seizure diary with maybe some detail of the seizures themselves. Thinking back to any medical appointments you've had, it may not even be about epilepsy. Have you had to go to A&E about something else? That might be useful to the neurologist. Definitely having a list of your medications and the doses. It's often very easy just to take a simple photograph on your iPhone or similar. Take a photograph of the packet. You don't then even need to remember a piece of paper. Show the doctor the brand of medicine you're taking and the doses and how often you're taking it. And also remember any other tablets you're taking or prescribed. You might not think there's a link, but for example, a woman being prescribed HRT, there can be some drug interactions between the HRT and the antiepileptic medicine that might be important to discuss. And then often bringing along a friend or a relative. They don't even have to stay for the whole appointment, but that can be very helpful, particularly if you're wanting to convey how seizures are affecting you, what happens during a seizure, but even just to be a second pair of ears to hear what the doctor's saying and maybe ask those questions you've forgotten to ask. I think bringing more people to the appointment can be counterproductive. It can be distracting to have 3 or 4 or 5 people in the room. And so that's not to be encouraged, but certainly bringing a friend or close relative is a good idea.